pandemic, how the Zhongshan experience or Shanghai experience can help us in control and prevent this disease, to balance our work on a day-to-day basis and also our focus attentions to the pandemic. I'd like to give 6 minutes for each of the speakers to make your own sharings. And start with Professor Ge Junbo. Thank you. All right, thank you, President, Vice President, Mr. Zhou. We know that starting from the last December, when we reported the first case in Wuhan of the COVID-19 patient, we started with a naming of pneumonia, but later we called it as infectious diseases. But until nowadays, of course, in the midnight this morning, after 76 days of complete lockdown, the Wuhan city has been able to be witnessing a phased victory of China of combating against the COVID-19, of being reopening to the outside world. We see to start when the whole world was caught in such kind of a battle against the COVID-19, when nobody is prepared. It started with a counter fight. Then by that time, we have no idea what we are fighting against, and there's no clue of how to do it correctly. With President Mr. Xi Jinping been chairing this whole anti-epidemic work, we have been making this war an all-out people's war against the virus. So, of course, when it started from the surprise attack, but later on move on into elimination war against the virus, of reducing this kind of severe cases to only 200, with 77,000 out of the 83,000 confirmed cases being cured and discharged from hospital. It's a phased victory, I would like to say. But as I was discussing with the U.S. experts and also counterparts, when this virus could come back, I'm not an infectious disease expert or professor. It's hard to answer this question in a nutshell, but for the patient's treatment, for the isolation of the source of infection, and also the protective isolation of those susceptible populations, those are the different factors that might impact the final result. But more than 50% of the patient might have the really mild and elevated to a critical case of the D-dive, of the kinase, of the CR2. The elevation is not that aggravated. They are accompanied with the renal function dysfunctions and also liver dysfunctions as well. This is why, like in the earliest time for the disease, I sent a text message to Professor Wang Xing when I was able to go to the front line to find what we can do for those patients. For many reasons, some of my request was not approved, but for Zhongshan Hospital, Zhongshan Hospital is home to the key laboratory of the viral microdiasis of the Ministry of Health. With this key lab, we have the studies conducted by Professor Yang Yujing and also the other professor for many years. We have these type of the cornerstones be still kicking running, even though we have less and less targets in our radar. This is why we sequenced the RNA for the single strain, and at the earliest time we shared this data. It has a S protein on its surface. It's actually a glucoprotein combined with AC2. It enters the cell. So we started to understand the sequence of the virus. With this knowledge, we've been able to really generate an antibody or antigen to really detect the existence of this virus. In the end of January, we have been able to develop a kit box for the IgEmic. For IgEmic antibody, when it entered the human body, it have the kinase being elevated. The IgM will be elevated, but later on be turned into the negative. but we have a very limited cases of the false positive. Sometimes they have IgM elevation, but sustained IgM elevation. We have a CMARC, Hygenol, and also through the liaisons of our offices in Africa, we are actually disseminating those kit box to Africa to help them detect these virus there. This is the first work we have done.
Since we started to have the testing kit already, and most patients died of COVID-19 were quite aged and old. And during the observation, we started to see exacerbation of the patients in their younger age, and they don't have any underlying disease at all. So we were wondering, with such a high CRP and IL-6, the inflammation storm may cause multiple organ failure and cause different organs to dysfunction. So we wonder if we can start to treat the inflammation factors. In China University of Technology and Science affiliated hospital, where I worked with, for IL-6 antibody, we started to diagnose the patients based on such index. If the patient is increased on IL-6 with the tocilizumab application, it can help to reduce the inflammation response. All the patients had really good recovery with the tocilizumab. So when transported the antibody to Iran, to Italy, we hope that they will work as well. Our Shanghai experience is very beneficial for the whole world for countering COVID-19, including CRRT and ECMO's experience. Talking about ECMO, if the patient is on ECMO already, we should apply ECMO for the patient before the acute exacerbation. If you wait too late, it might not only be too late for the patient. For our experience, as a clinical doctor myself, we studied IgG and IgM testing kit and have it developed, helping us to more effectively diagnose the patients and whether they are infected or not. But we cannot tell whether the virus is active or alive. Even if the virus is deactivated, the antibody will still be there in the body. So when we develop the testing kit, Professor Wang Cheng arrived in Wuhan in the early days. For the infected patients, the positive rate is only 30 to 50%. And there also be a chance of a false negative. So nucleic acid testing should be combined with antibody testing. It might be more beneficial and effective to diagnose the patients, and it will also be beneficial for the whole society and the economy, as well as to restore the normal working of the whole society. I think I still remember there was a TV news report for CCTV. After 6 continuous hours of work, there is vaporization in the garment of the nurse, and they cannot really see everything clearly. We were wondering if we can solve that problem for our nurses and the medical workers. Our medical workers wear the glasses, but if you wear the garments that big on the face, it might not be suitable. So we use the nanomaterials to study the glass and to develop a specific protective glasses. We also have the drying agents located in the glass, and our nurses won't be having the vaporization in their garments, and it will help the overall comfortness of their working environment. In February, within 1 month, we developed that products and sent it to the frontline hospitals, and that's also the contribution we have made. As a clinical doctor myself, for an unknown virus that we don't know the mechanism yet, we need to constantly find problems and try to find out the solution, and that's exactly what we have to do in the long-term run. Thank you. Professor Ge, didn't really have the chance to get to the frontline hospital, but with his support in the back end, we can still have his contributions. He started to talk about the protocol for inflammation storms and the cascade, and he has also developed many different equipment and garments for the medical workers. Thank you to Professor Ge again. Next, I would like to have Professor Yan to share some of his expertise with us as well. Thank you, Professor Zhu. Amid the countering of COVID-19 across the worldwide, we do have accumulated many experience from the past months, and particularly in China, we started to see the dawning of light. And in the past 76 days, since the lockdown of Wuhan, it has been 2 months, and until now, we have nearly treated all severe cases, and but in the other regions and countries, they started to see challenging times. It is still quite peak, but we started to see some hope of the tipping points and the declination of the overall confirmed patients. Under such circumstances, I think it's particularly necessary for us to continue our efforts. We should never forget how difficult it was in the past months. So we still need to work harder. And there are several challenges in front of us. The first challenge is the guiding principle now is we need to prevent imported cases and prevent domestic cases to go up again. We have a lot of asymptomatic patients. They are virus carriers, but they can still transmit the virus to the other healthy people. How to identify them is very important, and it is also very challenging. And such a challenging environment, we have to balance the economic growth as well as the medical prevention. Getting back to the hospitals, for oncology patients and for heart disease patients, we need to start to treat them as well. It is also urgent. We need to continue to fight against COVID-19, but we also need to provide sufficient medical care to those other patients with severe symptoms. There's patients who have the chance of getting infected for COVID-19, but they also have other underlying disease or even tumor. We still need to treat those patients as well. And those are all the challenges in front of us. As other experts had shared with us early today, we should never relieve our efforts. We need to continue with a stringent policy to have the system under control. In the past months, China's mechanism is proved to be a success. We need to have a coordinated and united prevention and control of the disease. We haven't got any utmost therapy to the disease yet, but we started to gain more knowledge of the virus and disease itself, and there's a lot of public understanding to the disease already. I think it has been laying a solid foundation for the future fighting with the disease. We're also adopting new technologies and facial recognition technologies. It is very important for us to fight against the pandemic. It is already a transparent and well-connected world. With coordination and collaboration in the future continuously, I firmly believe we will be able to fight successfully COVID-19, just like WHO is advocating now. WHO is calling for one world, stay at home. As medical workers and professionals and enterprise representatives, I hope that we can continue to stand together so we can continue to fight against COVID-19 until the success. Thank you to Professor Yan for the sharing. One world, one home. Stay together and stay at home. He said that we should focus on both economy and prevention control of the disease until the new phase comes. It is a complicated environment now in the worldwide. We still need to be cautious. Next, I'd like to have Professor Zhong Jie, Deputy President of Zhongshan Hospital, to share with us. Our medical workers, our president, and academicians had shared a lot of experiences fighting against the disease. I think my point is divided into three. I think, first of all, China experience is really worthwhile of recommending and referring. Back to 1 month ago, I told my U.S. friends that they should wear masks because at the end of January, Chinese government is starting to announce the first-grade emergency system. From President Xi Jinping to the municipal government, to all of the leaders, to medical workers, and to the residents, masks are basically worn by everyone. During the national meeting, we started to see President Xi Jinping wearing masks as well, but President Trump of U.S. is not wearing masks at all. I don't think he is acting as a leading role in this regard. So even back to 1 month ago, I was trying to tell my American friends, who is also a doctor, they should wear masks to get themselves protected, because back then they were still not wearing masks at all. Of course, there are other experiences to learn from China, including nursing as well as other medical treatment protocols. U.S. already has more than 400,000 confirmed cases, but China had still only 80,000 confirmed cases, and most of the new cases now is imported. It also shows China as a responsible big country. We know there's a risk for imported cases, but we are still not completely locked them down. We still accept them to get to China. This is why I think China experience should be referred and learned from, not only in the medical care alone, but also on the management side from the government. In today's Cyber Forum, we also have the leadership team from the Shanghai Municipal Health Commission. We also have the leadership teams of Fudan University Zhongshan Hospital. Our president and our secretaries of the party of the hospital also arrived in the meeting. So the experience is basically implemented from a top-side-down approach until the grassroots. Everyone in China basically is involved in the fighting against the disease. This is the reason I think China experience is really worthwhile of learning from the other nation. The second thing I like to say is, as academician Professor Ge had said, Zhongshan University has many experiences for adopting new technologies. Professor Ge had developed IgM and IgG ELISA testing kit for COVID-19 virus antibody diagnosis and testing. The sensitivity and the specificity can reach more than 98%. It is well proved in our clinical practices already. For the suspected cases, in Zhongshan Hospital, we have already restored our normal treatment to the other patients. For the patients with other diseases, but also suspected with COVID-19, we will be using IgM and IgG test kit to screen the patients. If tested positive, we will be sending the patients to the fever clinic specifically. If the patient is confirmed with not COVID-19, we will be more assured to do other treatment on the patients. Professor Fan Jia has also introduced our nasal mask. He has also said that during the treatment on the patients, we have renovated new devices, and there are also new approaches. I think all of them can be good experiences. The humanity has been fighting against the disease all the time. I think the most important weapon will be technology. As we always say, science and technology are the most important weapons to fight against the diseases. The key to reduce mortality and fatality of a pandemic is science and technology. So we have to emphasize on the importance of science and technology as two important weapons. The third is to build more confidence with the experience of China learned by other nations, because the whole human being has the same destiny. International community has to come together, and we need to be united in order to fight successfully the disease. We will be meeting our family members again very soon, I do believe. Thank you. Thank you to Professor Zhou for the sharing. China experience as one keyword. China would like to share our experience with the whole world. The next is fight against the disease with science and technology. The third is international collaboration. Thank you very much to Professor Zhong again. Next, I have Deputy President of Zhongshan Hospital and Chief Leader of the Zhongshan Hospital Medical Team to Hubei.
Hi, good evening, everyone. I feel glad to be able to joining this conference in such a way to be part of this global launch of the Zhongshan Guidance. It's been a week after I returned to Shanghai, but by the protocol, I'm still in a self-isolation. I have stayed with my 136 team members in fighting against the COVID-19 in Wuhan. I was all ears to presentations of the leaders and presidents. Some of them mentioned about the measures and countermeasures that equally were applied in the fight against the COVID-19 in Wuhan. It's a very rigorous and science-based. Professor Song Yuanlin, Professor Zhang Qiao also mentioned that from severe critical case to respiratory to the nursing to ICU, a lot of the measures were taken. And in fact, our team fighting in Wuhan is actually a good example of the cross-disciplinary collaborations in self-rescuing our patients. In frontline in Wuhan, we are actually all the way with our back offices and also headquarters. With their support, without their support, it will be not possible for us to pull off this mission. And indeed, I do feel the governance of the good governance of China when I was fighting COVID-19 in the Wuhan. Such a good supplies of the medical needs, and also such a good guarantee of the medical supplies, and also the well control of these really lockdown of the city. At the same time, the mobilization of huge amount of the manpower and also resources from all over China within such a short period of time after the outbreak is not possible without the good governance of Chinese government. It's not only seen in the really teaming of such a huge team of medical workers, but at the same time, the organization and also deployment of those teams into such a large province. Without a good team, without a really strong coordination of the government, without the great mobilization of resources and supplies, everything will be in vain. So the interference and also the medicines in use, of course, needs to be continue to be on the interesting point for us to negotiate, to communicate. But at the same time, we should try to find more ways to really learn how to mobilize resources in a more efficient way. Sometimes we call it the front line in Wuhan, but at the same time, home front in Shanghai back here, because it's always about the resource connections and also heart in heart, hand in hand, kind of a support in a reciprocal way, with our whole heart dedicated to the treatment for the patients in Wuhan. We know that everything here was taken good care of, and the vice versa as well for the home office people when we're fighting in Wuhan. So because we are a strong team to each other, we support each other very much. I'm still in the resting and also trying to get back to work as soon as possible when I finish my isolation or quarantine mandated, so as to play a bigger role to safeguard the health of our people, to safeguard our country. Thank you, Mr. Zhou. Mr. Zhu is a true hero in harm's way in the front line of the fight against the COVID-19 in an epicenter of China. He stayed there for 1 month of the time. He's actually the very promoter to have the experiences of Zhongshan been applied to the Wuhan. With the 5G, with China's the political systems and also good governances, we have been able to effectively curb the virus within such a short period of time. Now let me give floor to the CEO of a Group Medical Director, Northfield Health Service, Dr. Xu Bam Shuaibu Dambaba to say a few words, share your experience in UK's case. Thank you.
Thank you very much. It's been an excellent opportunity, and I want to thank the people of China for taking their time to share their experience with us in this part of the world and also the rest of the world. As you know, our Prime Minister is in intensive care at the moment, so our thoughts are with him, and we wish him quick recovery. I want to commend China for leading by example and for sharing their experience. I also want to encourage the world leaders and other countries to work together so we can fight this infection together. Unless we defeat the infection all over the world, no country is going to be safe. If we have one infection left in the country, you're likely going to have more transmission, and other people are going to be infected across the world. So we must fight this together. I also want to use this opportunity to thank Mindray, who we've been working with for a number of years, and they've been helping us in training our staff and supplying our ventilators through the Vice President, Mr. Lee, to say thank you to Mindray. And I want to encourage Mindray to please continue and increase their production of ventilators, as well as oxygen concentrators, because in some part of the world we have difficulty of shortage of oxygen supply. If we have good oxygen concentrators, we can at least use it for mild to moderate cases.
Sure.
Now, it's important that as a community we work together. I think I'm glad that you have Huawei today, and also you have Tencent, because one of the problems we have is the safety of our networks when we do teleconferencing and telemedicine. So I want to encourage us to work together to see how we can secure these networks. And again, thank you very much. We are going through difficult times, and I think we need to learn from your experience and to see how we can make it easier to mobilize health professionals across the world. Thank you very much.
Thank you. Thank you, Professor Dambata. Yes, the virus is the enemy of the humans. We meet together, work together, and fight together. We will give our hand to all the world. 那么非常感谢我们上面。
Thank you very much, the 5 keynote speakers and also discussion panelists for sharing with us. A few questions remains, including on 2 different topics. Like, for example, let me ask President Zhu Chouwen about how the medical teams from different places of China can actually coordinate your medical work, because you are actually part of the 40,000 medical team staff members from different parts of China. It's a good question. In the eastern parts of the People's Hospital, we have 7 medical teams. You have Qilu, China Southwest, Xi'an, Jiao Tong University Affiliated Hospital, and also Zhongshan Hospital ourselves. Different ways of work, different protocols they probably will have in mind, and nevertheless, all of us are under the aegis of the National Health and Commission. We have the very rigorous protocol on a science base to fall back to. But I have a suggestion here: is National Health Commission have issued really version 1 to version 7 of the guidelines for treatment of the COVID-19, continuously evolving and actually absorbing the updated best practices of treating the COVID-19. I think these kind of guidelines as a framework has playing a very important role in coordinating different medical teams. It comes to me in a better and more deeper way. Even though that the guidelines sometimes might not be strong in the evidence to start with, but at least it's actually the national government taking the lead and constantly evolving itself along the way, so as to, rule out some other, the conditions of off-label use at the doctor's own discretions from medical teams. We have been able to have a well-coordinated discussion and exploration of off-label use of many other alternative medicines, with, of course, the precondition of the patient safety first. It's Mr. President Xi Jinping that are actually been voicing the advocacy of good collaboration between different medical teams. We have been able to work very well with each other, just as if a team team for many years, and also been able to found a lot of the really like a how can I say, hardbone squad to really help us battle and make breakthroughs. There was no comparison between you and different teams about who might be the stronger team, all of us are actually fighting for the same goal. It's a good experience, of course. You have to start with the organized team in a standalone basis. But later on, how can we make sure that the well-organized team can actually be further rolled into a bigger map in a much well-organized way? This, of course, is some experiences we want to say. He said 3 things, thank you, including, first of all, national government take the lead of National Health Commission to issue some sort of the guidelines, continuously evolving, at the same time advocating the strong interactions and also collaborations between different teams. The second question is how can we actually do the really disinfections at the lowest the cost? We have an expert of nosocomial infection control expert, Professor Hu Bijie, who's actually the expert in this way, in this topic, because you are the best person to answer this question, of course, I would like to guess. Well, indeed, the most cost-effective way for the disinfection and also isolation or social distancing, I would like to say, is the very first stop. And the second is the mask. The third is the hand washing. The fourth is let the window open and also airflow. Room ventilated enough, sufficiently. The number 5 is avoid crowding or avoid gathering of the large crowds. These are the 5 advices. So bullet points, 5 of them, including social distancing, hand wash, have the room ventilated, wear the mask, and also avoid gathering. All right, thank you all. It's about to go. This conference is about to end. Thank you for your time. Ladies and gentlemen, leaders, my distinguished guests, we come from different places of the world. We have different color of our skins, and also the different way of lookings. But virus knows no border, and the outbreak is the common enemy to our mankind. We hope that the Zhongshan guidance that we launched here tonight will actually be very helpful for the combat against the viruses in a worldwide. May I invite you to wave to the camera with this kind of a little heart, red heart that we place on your table. We stand together with the world people, all people all over the world, and between Chinese people and also the people all over the world. As long as we stand together, we watch out for, we take care of each other, we will definitely welcoming or usher in the better future of all humankind. And I would like to announce the successful conclusion of the Fudan Online International Forum of fighting against the COVID-19 and also global launch of Zhongshan Guidance. I wish you all the best. Thank you all. Thank you. See you.